Hello there and welcome to this Med School Tutors webinar, Strategies for Success with Level, Step 1, and OMM. That may be an exam that you may have heard of, for Level 1 and Step 1. I don't know, it's kind of a big deal, wouldn't you say? My name is Dave Del Negro. I am actually an MD, but I have worked with many different DO students over the years, so not foreign to the concepts of Chapman's points and all other things like that. A third-year ER resident in the state of Pennsylvania. With me tonight is Dr. Patel, who is an absolute boss. Tell us more.
Oh, hi, everyone. My name is Sheil Patel. I am one of the DOs, so I'll be helping David talk more about Step 1, Level 1, and also OMM. And I am a sixth-year fellow doing a cardiothoracic fellowship at University of Kentucky. So welcome, and hopefully we can answer all your questions you have today.
It's going to be great. So tell us a little bit about who we are. I see a doggo in the picture.
Yeah, so we do this because we absolutely love tutoring. What our job here is to help you, students like you, who to go through this process. We have been there, so we know how much painful this process can be. So we're just here to guide you and possibly provide some kind of advice versus some tricks that can help you succeed in this process. David, do you have anything to add?
No, I think you said it well. We've been here a long time. I mean, 15 plus years, you're doing something right. You know, we do pre-med, the residency and board, and you know, the longer we do this, it's still so much fun to work with a student. And I had a dream about Step 3 the other day.
Oh man, that's
it's creeping in.
That's horrible. Yeah.
What are we going to cover tonight?
Yeah, so some of the things we're going to talk about is how do you make sense of your assessment score? Whenever you start studying for your boards, everyone's like, you know what, let me check it out. Where do I stand? How do you figure out what that means? Both David and I have certain opinions about which are the best resources to use. You know, these by no means are comprehensive, and these are just some of the resources, but our job is to also help you to figure out how you can avoid getting overwhelmed. We would also briefly talk about how to get a cohesive schedule in place so that you can be very good about following that schedule and getting a good study plan in. We will also talk about some common mistakes to avoid. And lastly, we'll talk about some of the tips that we have for OMM.
Love it. And then at the end, we'll do some Q&A action. So you've just taken your first NBME or COMSA exam, and now there's a number staring you in the face. And man, pre-meds and med students, we're not an anxious bunch, are we? So we're not going to intrinsically look at that number and determine things like our self-worth on it, right?
Not at all.
So the initial NBME is not meant to determine your destiny. And just, you know, we'll bring that stress level down, because most people, they take their first NBME, their first COMSA, and they're unhappy at that number, but that number is an incomplete picture. And as I like to tell people, your first 2 or 3 practice exams, the number means very little, because you likely have not gone through an entire COMBANK worth of material. You likely do not have your timing perfectly yet, and you're still getting used to the structure of, dare I say, well-written questions, professors and their questions. So it is an initial measure of where you are in your fund of knowledge. It is not an end-all, be-all. There is obviously a correlation between your scores, and that correlation gets stronger as you move through different NBMEs. So again, your first couple ones, let them wash over you, learn from them. What mistakes are you making? Where can you get better? And then later you start to make sense of the number. And the score report now, back in my day, I'm sure your day as well, Dr. Patel, we didn't have these fancy things like answer explanations, or even the answer. I think it just told us we were wrong.
Yeah.
We had to go into these sketchy websites and find out the forms of people with the answers. So,
or think about the page number that we might have
oh,
seen that and go back to that page.
So you guys
yeah.
have it well. You have answer explanations. You have really good materials. So your goal when you do NBMEs and ComSaves is, what do I want to get out of this? This is NBME or ComSave number 4. My first 3 were in the 400s, or they were in the low 200s for NBME. What sort of steps do I want to take? Because your final step 1, ergo level 1 score, will be determined by, as this says, the amount and quality of your step 1 prep. There's an old saying that the medical exams from the MCAT through the steps, through the levels, through your boards, they reward hard work, and they're designed not to let you out, just read step 1, read first aid and regurgitate. So any additional thoughts, Sheil?
No, you said it really well. Just remember through this entire process that these scores, as much as they help you guide, they are not the end all be all. So just because you did something or had a certain score on the first exam does not mean you won't match into the residency you want to. Just use that number to guide you in your studying and to focus on your weaknesses.
Well said. So tell us about the COMLEX checklist.
So when it comes to preparing for COMLEX, many times we like to keep the resources the same that we have had for USMLE. And the reason why is the concept and the basic knowledge is absolutely the same. The only difference that you need to figure out is how are the questions worded. When I took the exam, COMLEX was very much a second order question-based test. Now I hear that they're becoming more third order and fourth order. So you need to do more and more questions to get understanding of what the question is going to ask. And therefore you need to know the knowledge. Something else that comes in COMLEX that's not in the USMLE is OMM. And, question that we always get asked, and I'm sure David has been too, that how much time do we spend on this? The important part is you need to spend as much time as you need to get all the nitty-gritty details in for OMM. OMM is not a wide topic. It has, it's about 5 to 10% of the COMLEX exam. And those are very easy points. Like you can definitely have a better score than you would have if you did not know those questions.
Sliding over to resources now, and this is where, if you've met one tutor, because a lot of us have different opinions. But a lot of times, some of these things, like, the same resources sort of rise to the top. So here's some of the tried and true ones for our step and level 1. Just what are your general thoughts on how you use or don't use first aid or UWorld or COMBANK and all these primary resources?
So when I tutor, most of the time, I tell them to use first aid as pretty much a synopsis of everything they have learned in the first 2 years. It's by no means a comprehensive book. So it's a summary of what you have learned. So what I tell them to do is when they do USMLE questions, and if there's certain thing that they come across in UWorld questions that they haven't seen in first aid, go to that topic and annotate, because this will be the book that you will be reading or going through in the last few days or a week or so before your exam. And the COMBANK comes important because, first of all, you get an idea of how the COMLEX questions are. And second of all, you also get exposure to the OMM questions.
I like it. And again, the blueprint for success is really out there. So UWorld is, and always, I don't want to say forever, but is likely into the near future going to be the underpinning of most people's study plans.
Yeah, absolutely.
Now I somewhat diverge ever so slightly when it comes to first aid. I was never big into like reading first aid. I always felt like it was a little too passive, but it's a great resource for review of quick materials. You flip through the pages, see what you may have forgotten, what you may need to do extra work on. And if you get a question wrong and don't understand it, it's usually a great place to go and see what what little details may be there that you might have missed that to get that question incorrect. So, and once you've gotten your primary resources, you still have your secondary resources. And I mean, these they're growing all the time. Which ones are you a big fan of?
Definitely, as far as the OMT is concerned, this was my book to go to, the Savarese OMT review book. It pretty much was the whole 2 years of OMM combined in this one textbook, and it was a very easy read, so I really liked that, and I recommend it every time I tutor too. And then as far as the other books are concerned, I did like the Rapid Review of Pathology. Pathology was pretty high yield as far as the step 1 is concerned. So it was a good book to go to because it would highlight everything that I couldn't find in the first aid.
I like that. Yeah, I mean, and then we have our tried and true classics, Pathoma. Golian, I think, is probably underrated at this point because there's so many new things out there.
Yeah.
Sketchy Farm, which was always a classic. I was always a big fan of Pharmacology for the Med Student. I think it's a hidden gem. And then it's, again, as we we'll sort of slide into how do we layer our resources, because it's important, and one of those big things that we talked about in the beginning is how to not get overwhelmed either. You cannot do all the resources. There's only a finite amount of time and brain power and motivation. So a lot of times, a lot of my first lessons with students are, what have you used to this point? What do you own? What sort of constraints do you have? Because these things are expensive too. UWorld has a great product, and they know they have a great product, and they price it accordingly. So it's one of those things. And if you have like Golians and Pathoma, you may not need an extra boards and beyond. So, and it also depends, where are you in your study plan too? Are you just about to do your 6-week plan? It's go time. Or are you 3 months out and you're doing a pre-review? Or, a lot of times we'll see students, they've written their first plans, they didn't get where they needed to be, and now they're taking an extended time off. Do you have 6 months? Do you have a whole year? Those things will tell me, how many things you likely need, how we're going to layer them so they spiral together so that each concept builds on the next, and how much we can realistically accomplish.
I agree.
Any additional thoughts there?
No, you again summarized it really well. It all depends on how much time a person has to dedicate to this. I mean, if we could summarize most of studying and medicine to one word, it's probably depends. Yeah, exactly.
Admittedly, that's where we are experts in this.
Yeah.
The more complex the situation, the more we're able to sort of detangle. But this is nice. I'm a big fan of this slide too, because I'm a firm believer in that as your study plan sort of moves from the beginning to the end, you start to ramp up practice questions, and you start to specialize your topic reviews. Now, if you're sitting there at home in Zoom land, I think this is Zoom, and you're 6 months out, you have time to read through all of the kidney if you know nothing about the kidney. So if you are 4 weeks out, you don't have that time. You should really be doing 80-ish to 100, even 120 UWorld questions per day. I think this slide really sort of illustrates that well. You want to move from passive to active over time, and then try and test yourself, adding more frequent MBMEs or COMSAs, building that data collection. Again, that's one of the beautiful things. There's so many practice tests available. So, and out there, and where are you? Where is your goal score? How far away are you? So I think this is a real nice sort of illustration, because early, middle, and late could be anything. This could be 9 weeks. This could be 9 months. So, any other thoughts on how you sort of work with a student who may have a different different needs?
Yeah, no, I would do exactly what you said. Like, it's very important to get an idea of how much time you have. And the reason why we keep repeating this statement is because we can't apply what works for one person to our next student, especially because they have different circumstances. They could be taking their exam next week. They could be taking their exam a month later. So we have to, this is the reason why we keep saying that it all depends on how much time you have, but it's very, very, very important to utilize this time as well as you can, because, passing and failing is important, but at the same time, right now, when we still use the score in step 1 and level 1, it's very important to try and do your best, because the number of score matters too.
Yeah, I mean, it certainly does. And it's one of those things, especially if you are aiming for something particularly competitive. We could talk all night about the fairness or unfairness. So if you want to do neurosurgery, keep studying.
Yeah,
good luck. I always tell my friends. Nice to meet you. Yes. I'll see you when you're done studying.
Exactly.
So developing a study plan, because as we've sort of been circling around here, sort of beating it senseless, is it all depends on what's left. I once had a student who came to us, and then came to me by extension, who had just taken day 1 of step 3, just taken day 1, and had 3 days until day 2 of step 3. So what did we do? We did like 2 things only. We kept it incredibly simple. It was like, here's your CCS cases, here's your way to do it. Let's go back and forth for 2 hours a day. And they passed. And it's one of those things. You move. We develop study plans together. What's your objectives? I like this. Pick your calendar poison. So, and then you want to try. I'm a big fan of writing. I like to call them decelerating plans, where I make students pick among the high yield systems, the ones they hate or find the hardest, and then make them go from the one they find the hardest to the one they find the least hard.
Yeah.
So if you're doing CT surgery, you'd probably pick neuro as your least favorite.
Yeah.
Yeah.
And I do exactly the same thing. And the reason why is because even in real life right now, I don't want to study the stuff that I find hard. And
exactly.
That's how it's been. That's how it probably is for majority of the people that are on here on webinar.
And exactly. And as you go through your plan, you get closer and closer to the stuff you like. And 5 weeks in, you have that extra boost of motivation because it's cardio week.
Yeah,
exactly. The heart is shaped like this and tilted like this, and that's I'm in ER, so that's like sort of where that ends.
Yeah, it's present.
Yeah, I have the ultrasound. I'll figure the rest out. So, and again, assess if it's reasonable and doable. A lot of times, maybe 25% of like my first half hour of meeting someone, it's a weird math, is like, okay, we can't do all of first aid 3 times, and it's probably not efficient to do so. So, step back and, have you run your plan past your friends? What are they doing? Wisdom of the crowd. Have you talked to your academic advisor? Wisdom of your school experts. Have you talked to someone like us who's been doing this for many years? So it's always good to get many eyes on your plan to make sure you're not writing yourself into an untenable situation. So walk us through here. This is a sample dedicated timeline.
So this is an example of the calendar that David and I would come up with if we were responsible for a student that's about to take their USMLE or COMLEX. And as we have been talking about this entire time is we assign sections. And the reason why we do that is because every section is important. And most of the time we give attention to the sections that are easy and come naturally to us and put everything else that's harder. For me, it was nephrology. I absolutely hated that subject and I was really bad at it. So I would wait till the very end until I have to do it to study it. And that was 2 days before the test. And I was like, oh crap, now I need to study. So my goal with every time I have a student is to make sure that I ask them which is the topic that they struggle with the most. And without even telling them what I was planning to do, I make sure that that's one of the first topics that I cover to get it out of the way. And now it's just the easy stuff left because we have already covered the harder stuff. So that's exactly what we're doing. And we make sure that, of course, we have to cover biostats. So if this was a week before the test, this is the time where you cover stuff like biostats. This is the time you cover COMLEX, because those are all easy points and those are all you have to memorize some of the stuff. You cannot understand it like Chapman points. There is no way you're going to be able to be like understand the philosophy behind it. At least I couldn't. So I worked by memorizing it. So use the last week to help you with the topics which will be on the test, but it will also require some memorization.
I love it. GYN oncology was my big downfall. I couldn't tell you a single thing about any of the follicular cells and all the other cells. And to this day, it's one big, it's ovarian or it's uterus. And that's sort of where that ends. I'm gonna write you the script for this ultrasound. Everyone's got the things they're just naturally good at. Everyone got the things that just twist them into pretzels. So, like we said before, is this feasible? Tell us a little bit more about, med students wanting to write plans, assuming they'll be 100% every day.
That's what we all want. We all want to be perfect. We all want to think that we will be able to do everything. But let's be realistic. There are things in our day-to-day life that we have to do, like take care of dogs, take care of family, go out, go to lectures, go to conferences, whatever else we need to do. So the one thing that we have to keep in mind when we start studying and setting up a schedule is to make sure that you think you can do it. So if there are 5 hours that you think realistically you can study, there's no reason to tell yourself, you know what, I'm going to give myself a schedule for 7 hours, because that will just put you behind and prevent you to be in a good mood for the next day. So you have to be real with yourself. Do not overestimate your capacity to study. Everyone needs breaks, and you need breaks to make sure that you succeed in whatever you plan on doing. And if you don't take breaks, then one of the things that you can definitely do to yourself is burn yourself out. Anything else you want to add?
No, that's perfect. I mean, I think it's a quote. I'm going to say Larry Bird, because it sounds like something Larry Bird would say. And it says that if you only do work on days which you feel good, you'll never actually get anything done. Mm-hmm. So it's one of those things. So, not every day is going to be the perfect day where you get a 90 on UWorld. Mm-hmm. In fact, probably most days are 70 on UWorld. That's just the way UWorld rolls. Yeah. So, make sure you build in like that flexibility. A lot of times when I write my schedules, my students ask why there's so much free time. And then 3 weeks in, when they've had to rearrange things a couple times, they say, that's why there's that much free time. Because now we're not behind any. We're not behind.
Exactly.
We're here together still. And if you write this super, life happens. Mm-hmm. People get sick and stuff like that. So flexibility.
Agreed.
And go through real quick for us some of these tips to reach your best score. This is high yield bullets right here.
Yeah. So the most important thing is, this is a test. There are only a limited amount of questions that they can ask you. So, when we go through the first 2 years of med school, there's always going to be times when your professor, your faculty will be like, this is high yield. So always keep in mind, make a mental note, hey, this is high yield. I am going to, spend some time on it. Again, it's important to go over the topics that you don't think you're comfortable with, but again, do not spend too much time over studying it, because you need to know it, but you also don't need to spend 2 days on it and ignore everything else. So that's something that you need to remember. And as we already mentioned several times in the last few slides, is that your schedule is fluid. It will change and it has to change. So you just have to change with it and accommodate accordingly.
I like that. Keep it fluid. Be like water. With
Yes,
Bruce Lee.
exactly.
All the quotes tonight. It's just gonna be.
Yeah, I love it. We're doing great.
And then of course I always like to remember, use the people who just took step in level 1, use them as a resource too. They may be in the hospital, but when they wake up from their weekend or whatever, ask them too, because like your PhD professor's definition of high yield may or may not be sometimes the same as the USMLE or the USML, the equivalent DO organization.
No, I agree. I definitely agree. That's a good point.
Because PhDs want to tell you about their research. Bless their soul. that's high yield to them.
That's 100% true.
I remember it like it's yesterday. Using UWorld efficiency. UWorld is still to this day, and as we said, likely into the near future, the #1 COMBANK, and it's not just an assessment tool, it is a learning tool. Mm-hmm. Now, these days, AMBOSS is knocking on the door, and they are very good. To this point, I still consider UWorld to be #1 and AMBOSS to be 1B or 2, depending whatever, but some people are using AMBOSS as well. What's it called? Use it to learn, use it to understand, go through the answer explanations slowly, especially in the beginning, because, and try not to make this mistake. I usually tell most of my students, tutor mode, systems based early, timed mode, random late.
Yeah, agreed.
A lot of people, they'll come to me and they've done the opposite. It's like 3/4 of the way through, and I'm like, well, yeah, can't change it now. But they all come with the same sort of chief complaint. I know things, my scores are okay, but I can't seem to get over that hump because you never did 12 consecutive cardio questions to get the small minutia detail between CHF and what's it called? What's another heart thing? Heart attack. Why am I forgetting?
Cardiomyopathy.
There you go. Yeah. Just gonna give Lasix to a tamponade real quick, right? That's
we love Lasix.
Yeah. So yeah, start off with that. Try and figure out the details. I used to tell people, this is why you did the verbal section in the MCAT, to try and understand what the main idea is. And if you understand the main idea, it should be in your head when you look at the educational objective at the very bottom of the UWorld screen. And if you are close, you don't have to be perfect, but if you are close, that is a good sign you are the right path. If you are not close, it's a good sign that maybe you need to step back and think about it more. You need to scan it a little bit further. If you got it right, did you get it lucky? Getting it lucky is great in the real thing. Yeah. But in the practice, you want to, you practice. You get them right, you assume they're wrong if you don't understand it. So do not write a step 1 textbook. I tell people 1 page front and back per day of notes. Yeah. And it makes people a little squeamish sometimes. You're writing too much. So I usually recommend people write over type, because there are good studies that show that when you write, you are forced to grapple with the material because you cannot write as fast as you type. And that's where the learning happens. When you type, you are basically a court stenographer, and you are copying and pasting instead of thinking and recapitulating. Yeah. Flashcards. I usually tell people, if you're using Anki, you should have 2 main decks. One is a high yield deck with your HLAs, your autoantibodies, your rate limiting enzymes. There's like 200 or so flashcards with things that are Chapman point, go here, I assume, with things that are just straight rote memorization. And if you do enough of them, there's free points there for you. Your other deck should be, what things have I gotten wrong? What am I bad at? And again, 1 main takeaway per question. I usually tell people no more than 10 flashcards per day. You're writing too many, too much. And then your UWorld notebook. So that's a small vomitus of some of my best practices. What are some of the pearls that you like to share with your students?
I definitely highlight very early in the course or very early in our sessions is that the UWorld is, as you said, a learning tool. So far, this entire past 6 years, I have taken plenty of tests in addition to what we had to take. And every year, I realize that more and more that the better we use these questions as a learning tool, the better off we are in understanding the concept. And the reason why I say that is because once you realize that these are not there to assess how well you're doing in a topic, rather to teach you things, you will spend more time in getting to know those topics. So I highlight that a lot with all my students and make sure that they know that. And then also, as you mentioned about taking notes, I tell them also to write notes rather than type notes, especially because with typing, they can copy paste a section from one area to the other.
Sure.
And then when we talk about it the next day, it's like, oh, I don't remember what I typed. But when you write it, you are there all in. So it's important. It's much better to remember.
Love it. Yeah, no, it's good to see that like a lot of best practices, they overlap, and we do know a little bit about this.
Yeah, just a little.
Skosh. Any other thoughts here? Yeah, good stuff. So we're going to dissect a USMLE. Used to hear it called You Smile, but you don't smile when you take USMLE. So we're going to dissect this question, and we're going to make it interactive. So once you figure it out, toss the answer in the chat. 55-year-old alcoholic male with a severe abdominal pain, nausea, vomiting, elevated amylase lipase, deteriorates, severe respiratory illness. There's crackles, rails in the tails. This is what the x-ray looks like. Unfortunately, he fails to respond to intubation and mechanical ventilation and passes because of respiratory insufficiency. Which one of these is the most likely finding? And I'll give you guys and gals a few moments. We have a C come in. Yeah. We have a B come in. And so just as you guys and gals answer, I'm going to walk through. Now they've underlined the big things that are very helpful. Alcoholic male, severe abdominal pain, elevated amylase and lipase. The first order in this question is pancreatitis. The second order in this question is what are some common sequelae of pancreatitis that lead to severe respiratory disease? In this case, with this bilateral whiteout and not having COVID on your differential yet, it is ARDS. So your third order in here is what part of ARDS is most likely to be seen on an autopsy. So that's sort of a nice way to sort of think about this. And ARDS, or acute respiratory distress syndrome, is also sometimes called alveolar hyaline membrane disease, because that's what you will see. You'll see little seepings of fluid come from the alveoli that increase your diffusion, if you remember Fick's equation and all that fun stuff. And ergo, it is B, alveolar hyaline membranes. And again, as you read this, you should be sort of thinking through your head, because the more orders in a question, the easier each order has to be in order to solve. If it's a first order question, they can put as many twists and turns as they would like. But this is there's a third order question, so they have to make it fairly obvious that it's pancreatitis, and then give you a sizable but easy-ish jump to ARDS, and then the final jump to hyaline membrane disease. So again, read actively, read like you're reading the verbal section of the MCAT, what I always tell people. So switching gears a little bit, we're going to talk a little bit more about OMM in level 1. OMM, osteopathic manipulative medicine or technique, therapeutic application of manual pressure or force. my colleagues at my residency have graciously offered to fix my neck and spine at times, and it is very nice. We actually have an OMM table in our resident workroom.
Oh yeah, it comes
Yeah.
very handy.
Very handy. I take naps on it and occasionally get the spinal manipulation. So,
Oh, Emily stands in line when I go home just because they all are like, I need this, I need that. So yeah, definitely.
And it is very important because it makes up approximately 10% of the COMLEX exam. And again, if you do your due diligence, these are points that you will get. They're points that you will not miss, and there's no reason to miss them. So tell us a little bit about the ways they're going to pose or post, I guess is the word we use, OMM questions. What are they going to look like?
So there, you know, throughout this whole training, we have realized that there are 3 common ways, and of course, these by no means are comprehensive, that they like to post OMM questions. And the way they do that is, first of all, they'll give you a vignette about some other pathology, give you a short explanation of an OMM finding at the end of a vignette, and then they will give you an OMM question. So initially, when you start reading the question, you will think, oh, this may not be an OMM question because they're asking me about a certain pathology. But as you continue to read, you realize, oh, okay, this is an OMM question, and the answer may have nothing to do nothing to do with the entire vignette except for the last sentence in the question. Some of the OMM questions are just straightforward about viscerosomatic points, Chapman points. You know, sometimes you will, because these are standardized tests, they will always have a bigger vignette associated with it, however, will not have anything to do with it, or they're trying to do a second order or third order question. Well, they'll give you the symptoms and lab work to diagnose a patient, and then with that, they'll help you, or they'll ask you what's the associated Chapman point, or how would you treat the patient. And then lastly, they will just give you an OMM finding without any vignette or anything, and they'll ask you, how do you diagnose, or what's the diagnosis, or they'll ask you how to treat it. Some of the resources that I highly recommend every time we talk about OMT is the Savarese book, as I mentioned earlier. I was used to the 3rd edition. They have since then come up with the 4th edition. It's a very nifty book. Like, it has everything that you were to come across as a DO student in your first 2 years of medical school. And then in addition to that, just to reinforce everything that you have just read in the OMT review book, you can also use COMBANK questions. You can use COMQuest questions. Again, these questions are a good resource that you can use as a learning tool rather than an assessment tool. This is an OMM cheat sheet that we often use as part of med school tutors to our tutorees. Here we talk about the 3 of the highest yield facts that we recommend knowing for the test. And the reason why we think these are the high yields is because we have seen this asked on and on in all the tests, and also in plenty of question banks. So some of the things that we definitely need to know is the craniosacral motion. In reality, it's a very hard thing to get concept of. However, those are, again, very easy points in the exam. So that's something to review before the time comes. And then something else is viscerosomatics. And the reason why viscerosomatics are important is because they will give you a diagnosis. And based on that, they'll try and help you, they'll try and see if you as an osteopath can figure out which sympathetic level is that particular diagnosis related to or referred to. So just something quick to review at the end. Again, by no means this is comprehensive. You have to study OMM, but towards the end, if you're trying to just look for high yield topics, this is something nice that can come handy.
Love it.
And then in addition to what we previously talked about, some of the topics to watch out for because and you would like to know, or we recommend you know inside out include the Chapman points. And the reason why we have mentioned Chapman points so much is because those questions, at least 1 or 2 questions, will be asked every year at in the COMLEX exam. The viscerosomatic reflexes, counter strains. Ribs are also pretty high yield on a COMLEX. They will ask you the difference between pump handle and bucket handle movement. It's just the type of movement ribs do in the top ribs versus the bottom ribs. And then they will also ask you how to diagnose and treat different dysfunctions of the ribs. These are easy questions to ask, and that's why they majority of the times ask you, because most of the time you don't even need a vignette with it. All they have to tell you is that this is dysfunction, and then they'll give you several options to see if you know how to treat it. And then also we talked about a craniosacral movement.
We have a question.
Oh yeah, let's do this. So just like a previous question that we came across, this question talks about a 32-year-old obese female who comes to your office with a generalized abdominal pain. She's non-compliant and groans when trying to obtain a history. Vital signs include 98.4 temperature, blood pressure is 134/76, heart rate is within normal limits, so is the respiratory rate. Physical exam shows that she's obese. She's in moderate distress, guarding and displays guarding of her abdomen. However, has a rubbery nodule palpated in the 7th intercostal on the right. So they would like, based on this, first of all, they would like you to figure out what the diagnosis is. Second of all, so they would like you to figure out what the diagnosis is. And the clue for this diagnosis is this OMM sign, which is the rubbery nodule in the 7th intercostal space. So out of all these options, can anyone guess what the answer choice is? Or correct answer is? So we have some B's coming in. So again, remember, it's the 7th intercostal space on the right, not the 6th. That will change the answer. So if you go to the next slide, David. So this is a very good synopsis of the Chapman point, and that's what they were referring to earlier. The rubbery nodule will tell you that that's the Chapman point. And the reason why we think that the answer in this case is the pancreatitis is because the 7th intercostal space has on the right has the rubbery nodule that will associate with the pancreas. However, the 6th intercostal space is the one that will suggest gallbladder or liver issues. So, you know, just a small intercostal space difference is what will tell you which diagnosis a person has. However, if you were to review this just the day before, the night before the exam, you would remember, hey, you know, the 6th rib was this and the 7th rib was this. So again, this can be a very easy point on the answer, on the test.
We're coming sort of to the end, so just some high yield tips.
So, you know, as we have talked about this whole the webinar, some of the important things as far as OMM is concerned is review before the test, read Savarese at least once, preferably twice before the exam. And this by no means means that you review it or start reading it the day or 2 days before the exam. This is over the 2 years of med school that you're going to be in, or the last 6 months. Do OMM questions. Again, you know, remember that it's high yield, and the reason why it's high yield is because those are easy points to get on COMLEX, so go for it, do not ignore it. And then, you know, you can always consider MST or us to help you out in this process if you ever need be.
Well said. So as we sort of touch down, we're going to have the live Q&A. Before we do that, just talk a little bit about sort of, again, what we do. We offer everything from pre-med advising to MCAT, in this case, step and level 1 is sort of the target audience. But even sort of, you know, digging a little bit deeper, schedule creation, content review and learning. What's it called? Test taking skills. going through answers together. I think some of the ones at the end are very helpful too. Accountability, mentorship, and guidance, because it's always good to sort of have someone to bounce stuff off of, because most of the tutors here have probably seen that question and probably got that question wrong at some point too. So, and that's sort of the goal, is to help you, to hold the hand metaphorically to get you to the next step, to eventually where you want to be, your goal zone, your goal score. We also have one-time schedule sessions. We also do different stuff for like residency application. So if it has something to do with medicine, I bet you we probably can do something to help you out. So just to keep it fairly simple. And again, why DO students do choose us. Tutors hire 250 plus, 630 plus. And even like by myself, who is an MD student, worked with plenty of DO students. I know plenty of DO residents and attendings. So and some from recon actually, where you're from. So it is a small world. We all do know each other. And what's it called? If you have any questions, now is the time to send them our way. If you have any questions that you don't particularly want to type here, you can always send them to this email address offline as well. This is how you reach us, by mail, by, I assume, cellular telephone at this point, and there's a little thing on online. Thank you, Devin. And again, if you don't have any particular questions, it's always nice. Thank you for just saying that this was helpful, because we still love doing this. This is a pair of residents, one of which is much more accomplished, and that's Dr. Patel. Now,
this is my outlet. It's nice to talk to people and tell them, do this too.
It is really my favorite book. How to avoid being distracted. That is a good question from Vassell, and it is a can of worms. So I'm just going to give a high yield hit or two. It depends on what your distraction is. Your phone should be in the other room. I know people. I heard a real interesting one recently. I forget who told me. They said they would let their phone drain and die in the beginning of their study. Yeah, a little extreme. So you can probably just put it in the other room. But if it's dead and you don't have any chargers, you can't be distracted by it.
Wow.
So, yeah, hey, whatever floats the boat. There's websites that limit the amount of time. I highly recommend very strong de-escalation, if not cessation, of social media. In general, there's a lot of studies, it's not great for people in general, but maybe an hour or two a week on social media just to say hello to your friends. And I always tell people 30 minutes a day, average over 7 days of friends and family, sunshine, exercise, the things that you enjoy. You have more time than you think when you're dedicated. Your job is to eat, sleep, poop, study in some order and repeat. So that's all you have to do. So go to the gym, do fun things, get outside while it's still nice out. Sheil, what else sort of, how do you stay? Now I'm getting distracted. How do you keep from being distracted?
Yeah, no, I agree with everything you said. I think the most important thing that distracts us is our phones, right? This is our lifeline. We get curious about who texted me, who is, on social media right now, everything else. And the reason why that happens is because in our minds, we want to do anything and everything but studying.
Not you.
Exactly. One of the things is important is one thing you could do is put your phone in airplane mode and just put it in the next room, or you could just put your phone on silent in the next room and then study for a couple hours, take a 10-minute break and make sure that there are no emergencies going on, no one is trying to reach you. and then come back and start studying. It's okay to use your phone. However, you have to just remind yourself there are other things to do. And then as soon as your tests are done, which is in 3 weeks or however long, you can spend as much time as you want on your phones and no one's going to stop you. So that was my incentive. Even right now, when I wake up at like 4 o'clock in the morning, my incentive is like, you know what? When I come home
You're
tonight,
a surgeon, aren't you? Yes.
so that's what I say every morning. When I come home, I'll go to sleep. And that's my incentive. So you have to find your own incentive to make it work.
Oh, that's awesome. Yeah, with the advent of do not disturb mode, I find that very helpful too. Because there's a breakthrough for, you know, heaven forbid or God forbid there is an emergency. If someone calls you twice, it'll break through the silent mode. And that's a lot of times I'll recommend to people. If you're anxious that something theoretically could go wrong, especially if you have significant other, wife, husband, children, something like that. If someone calls you twice, obviously it'll go from silent to ringing. Yep. So that is helpful. Then, you know, communication. If you have, you know, if you're at your parents or significant others, you know, make sure that they know it's study time. Mm-hmm. So study time is not fun time. So, but though, like you said well, fun time will be later. So, yeah. Just got to eat your vegetables first.
Exactly.
Vitamin U for UWorld. So, all right, with that last cringeworthy, I don't know if it's a pun, but I'd like to bid everyone adieu. Dr. Patel, thank you so much. It was a pleasure.
Same here. Thank you so much. Thanks, guys, for joining us.
Yeah. So good luck out there. May the force be with you and also with you.
Bye.